Joining us now is the director of the CDC, Dr. Rochelle Walensky. Dr. Walensky, good morning. I hear a lot of people yelling hallelujah. A lot of people are happy to have those masks going. So I guess the question this morning is, and some people feel this way, is it over?
Good morning. I am cautiously optimistic that we are seeing this great endpoint in sight. But I think we really do have to be humble and say that this virus, this pandemic, has given us twists and turns. So we can't get our eye off the ball, and we do have to continue to monitor really carefully.
I think it may be a little confusing for people waking up this morning because they heard the CDC yesterday saying, great, if you're vaccinated, fully vaccinated, you don't need your mask. But if you live in New York, New Jersey, North Carolina, Virginia, among other states, they say they're taking that under advisement and they will have their decision later. So I guess who rules? Is it the CDC or the state?
Yeah, I think that this is really important. We needed to take this first step to say if you are vaccinated, individuals themselves are really safe to be able to take their mask off. But we really do need to understand that this country is not uniform. There are places in this country that still have higher rates of disease. There are places in this country that still have lower rates of vaccination. And so really people need to look into their local environment because ultimately we know that this virus is an opportunist, and where there are low rates of vaccination, it will emerge again. And so we really need to make sure that we get people vaccinated and we still continue to take precautions if people are not vaccinated.
Yeah, and there actually is no way to really know who is or who isn't vaccinated. There's just sort of the honor system. So if, for instance, I, who am fully vaccinated, walked into a restaurant and there was a guy next to me who was not vaccinated, who's hacking and coughing, what kind of a risk does that person pose to me?
Right. So really what we've done is we've empowered the American people to make their own decisions about their own health. And what I can tell you is certainly if somebody's hacking in a restaurant, I'd like them to put on a mask. And more importantly, I might encourage them to get vaccinated if they weren't. But what I would say is that if you are near that person and you are vaccinated, your risk is really quite low.
Yeah, and what about planes and trains? I thought that was interesting. They were basically saying that you can go to a high school basketball game indoors, but you can't get on a plane or a train without your mask.
So what we need to do now at CDC and really across this nation is to take this guidance and revise our guidance across a wide range of settings and areas. So we need to look at our travel guidance, we need to look at our school guidance, our child care guidance, our camp guidance. And now we need to do the work one at a time of revising that guidance, and travel will be high among them. We also need to recognize that in our travel guidance, we also have a travel policy, a national travel policy. So we need to have an interagency discussion about how that policy is going to be revised in the context of the new guidance.
And, you know, yesterday, Dr. Walensky, I was actually at the Central Park Zoo with my daughter, who's 4 years old, and I heard about the news, and I was so happy. I was like, I'm going to rip off my mask. And then I see my 4-year-old, and I'm like, well, actually, no, I can't, because I'm trying to model good behavior. And I'm wondering if all these people now going without masks will have an impact on the little ones who can't yet get their vaccine.
Right. So, you know, we should celebrate some good news this week in that context, and that this week we were able to make vaccine available for 12 to 15-year-olds, the Pfizer vaccine. But you're right. We still have, you know, all those children between the ages of 0 and 12 who aren't yet eligible for vaccine. We're working on it, but they're not yet eligible for vaccine. And we will still ask them to wear a mask because they are not vaccinated, and to protect themselves and to protect others. And in fact, yes, parents and perhaps even teachers may want to continue wearing masks to model behavior for them. I should also say that people may want to continue wearing masks because we've been wearing masks for 15 months, and it's going to be hard to let go of them, and we should be able to do that in our own due time.
Okay, and just lastly and quickly, the head of the teachers union said yesterday that she thinks all schools should reopen 5 days a week in person. Do you agree with that?
We've been saying that at CDC for several weeks to months now. I believe that with the vaccine, with the mitigation strategies that we have in place, with all the testing strategy that we have in place, thanks to the American Rescue Plan, that we really should all be back to school full-time, 5 days a week, teachers, children's educators alike. So yes, I'm all for that plan.
And I also predict that lipstick scales are going to go sky high in the coming weeks.
And
just a guess.
visits.
All right. Dr. Walensky, thank you so much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.